Hi friends, today I am with Dr. David, PhD psychologist, and let me introduce to you and he will explain to you about himself. Hey Dr. David, can you explain about your credentials and what is your background, and can you explain?
I'd be happy to, Dr. Shekhar. I'm a clinical and forensic psychologist, and I live near Reading, Pennsylvania. And I've been in practice of psychotherapy and psychological assessment, forensic assessment, and also psychopharmacology for the past 45 years. And I went to Temple University to get my doctorate, and then I went on to Fairleigh Dickinson University in New Jersey to get my postdoctoral master's in pharmacology. So in another state, New Mexico, I'm able to prescribe medications. But in Pennsylvania here, I have a private practice doing forensic psychology. I've authored or edited about 8 books. And many years ago, I got interested in transcendental meditation, which I practiced for, 53 years now. And I also got interested in Ayurveda, specifically Maharshi Ayurveda. And that is the reason I'm here with Dr. Shekhar today, because he has a wonderful clinic, Ojas LLC, and I'm going through his treatments, which are very beautiful and very healing. And it's very important for people to understand that psychology just deals with the mind, but we are mind and we are body and we are spirit. And Ayurveda, particularly Dr. Shekhar's approach, integrates all of those 3 domains and brings balance and equilibrium, health and healing simultaneously to all those 3 areas and even more. It involves specialized treatments, which Dr. Shekhar is an expert at, and they are I'm going through them right now. The particular program I'm going through is called Panchakarma, and it is a very pleasant experience. Unlike a lot of medical procedures that you go through in Western medicine, this one brings great bliss to the physiology and to the mind. And that's very important, because why do people go to see a psychologist? They want to be happier. They want to solve problems. They want to achieve their goals in life. But there are many things in the body and the mind that block or are obstacles to achieving those things. So who doesn't want to be happy? One of the fastest, most effective, pleasant roads to achieving happiness and balance is Ayurveda. And we're very fortunate to have Dr. Shekhar in Lehigh County, Coopersburg, Pennsylvania, which is only about an hour from my house near Reading. That he has a wonderful clinic here, and he treats people constantly. He takes one patient at a time, and he works very specifically with them and tailors and individualizes their treatments, so they don't just get a general approach. They get a very specific type of treatment, which involves diet, which involves the practice of meditation. It involves specialized herbs. There's many approaches to Ayurveda, which is a system, probably the oldest medical system in the world, thousands of years old, that originated in India and was brought out and fulfilled in its fullest form by Maharishi Mishogi. And Dr. Shekhar was a student of Maharishi and was trained by him. And he has traveled the world, all over the world, spreading the knowledge of Ayurveda. And I admire him very much for that. And he is a particularly skilled practitioner, because I have met many Ayurvedic doctors. They're called Vaidyas. Is that a Sanskrit word, doctor? Yes. And he's a particularly personable, warm, and highly skilled Vaidya. And it's a rare combination for a Ayurvedic practitioner. And I'm having a wonderful time. I'm here for 10 days of this deep, relaxing, purifying treatment. And I'm on my 5th day. I'm about halfway through. And I feel completely different from when I walked in the door 5 days ago. I said to Dr. Shekhar, I haven't felt this bad in my whole life. And I feel like in a couple of days, through talking with him and also his treatments and being in this very blissful environment, high energy environment, and he's very high energy, I feel transformed by it. So it's been a very wonderful experience, and it has taken the science of Ayurveda and it has become practical and very concrete and efficient and effective for me on a personal level. It's not just a theory, it's not just books we read, it's not just wonderful knowledge you can get on the internet. It's very practical, and it complements Western medicine, and it fills in a lot of the gaps in Western medicine. We talk about prevention in Western medicine, and there's very little formal preventive treatments. And there are also a lot of interventions in medicine which are incomplete or not effective enough. And Ayurveda interlocks with Western medicine beautifully and creates this seamless continuity of care which we really don't have without this precious knowledge which originated in India and is embodied in a doctor like Dr. Shekhar. Dr. Shekhar, do you have anything you'd like to add to that?
Thank you, Dr. David. And
Yes.
it's a great pleasure to have you here in our center. As you know that I started my Ayurvedic education in 1982. So almost 4 decades, 40 years of my experience in the Ayurveda. I studied Ayurvedic medicine in the 2 different universities in Andhra Pradesh and Gujarat, where I have a master's degree, Doctor of Medicine in Ayurveda for 9 years of medical school. I studied for 9 years of medical school and my dissertation on the bronchial asthma and respiratory disorders. And I traveled extensively more than 30 countries around the globe. And finally, I ended up in Coopersburg in Pennsylvania, where I established my practice 25 years. So, my goal is that I'm a licensed integrative massage therapist. In my practice, I do all the modalities of the healing of the people. I evaluate the person according to the body type, according to the individual body type, and according to that, we create a specified food schedule and dietary lifestyles and everything, and also treatment plan, also therapies, also according to the individual needs. So for example, Dr. David cannot take the high heat, the steam therapies and everything, he cannot take it. We have to be mellow down, slow down. And sometimes he needs to have a deeper tissue massage, sometimes a gentle massage. So these are all the different types of things we can accommodate according to that. We see the difference within a few days. You see the big difference in him that when we are doing Shirodhara, and he went to the deep transcendental state completely. I just allow him to go, and the deeper silence, it can start to heal. So what we call as an inner intelligence of physiology, we are tapping the inner intelligence of the physiology to heal itself. Body having a capacity to heal itself. We have to allow the body to heal naturally. This is the way we do it. Now it's a warm snow day and full of snowstorms and everything. We are not fearful and we are enjoying the bliss of the happiness and everything. Prepared wonderful food and we made a chai. This is called chai talk. So chai talk. In the chai is a classical way of drinking of herbal tea and the black tea combined with the milk and with the spices such as black pepper, cardamom, cinnamon, cloves, saffron, all the different types of herbs together, boiled together in a concoction way, and milk with the milk boiled. It will be a nice soothing and very gentle and digestive, and everything is a digestive tonic like that. It feels like that. It is stimulating. It's not caffeine. Too much caffeine is not there when combined with milk and spices. It will go into the very systematically like that. It feels very relaxing, and it's really good to have this type of chai in the afternoon time, and you feel more relaxing. And this is the thing exactly what we are trying to do it here. Nothing is wrong, but it's a balance. Ayurveda talks about the balance. Everything in the moderation is very important. Ayurveda means balance. Ayu means life, Veda means knowledge of life, knowing about knowledge of life in entire physiology by using of panchakarma, detoxification and diet, lifestyle and all the modalities, and meditation is highly recommended. And we are fortunate that we both in the family of a transcendental meditation family. We meditate. He is also advanced Siddha. I am also Siddha. We studied, and I was fortunate to spend time with His Holiness Maharishi Mahesh Yogi Ji in Netherlands, and I am blessed to have such a wonderful guidance and knowledge, a reverend scholar in my life, a guru. We can, whatever you feel, that I felt like that I connected to him, and we feel that that energy is flowing still. He is in our physiology. We are always thinking about that, and that Maharishi Ji says always that bubbling bliss.
Yes.
That bubbling bliss is required, and then only your consciousness will start to evolve, and automatically we see that enlightenment and everything. We strongly recommend people to meditate, and healthy eating habits, lifestyle, and regular panchakarma therapies and detoxification therapies, and the longevity of life increases, and ultimately healing your physiology, psychology, your mind over body. That's the thing. You have to keep that mind in your body, like the thinking like that, mind over body. You can do it. Nothing is a rocket science. You can do it. You will feel it, and you energize it. That's the thing. We are thankful to Dr. David O'Connell for giving, and he has written wonderful books also. If you are interested to read, Dr. David, can you tell about your books? What you wrote books?
Yes. The other thing I wanted to add about Dr. Shekhar, he's traveled the world literally and brought this precious knowledge to many countries in South America, in Europe, in Canada, in Russia, all over the world. He trains other doctors, other healthcare professionals in the basics of Ayurveda and how to take these principles and practices and for personal use, because it's important to keep, the healer should be balanced too, and utilize them in daily clinical practice. And I would like to say, before I start talking about my books, that I've been doing psychotherapy for patients for over 4 decades. And one of the things that I see with Dr. Shekhar is I can ask him a question about anything: social situations, social conflicts, family functioning, psychology, spirituality. And he has an amazing knowledge in all those areas. I don't know how he got it, because I'm pretty amazed. And I feel like a student when I'm with him, because every time I talk with him, I learn something amazing and new. And I've been at this for a long time, and you can always learn more. But this is embodies a specialized knowledge, and it radiates and emanates into all areas of life. It's truly holistic. And I always felt as a psychologist that just psychotherapy, just talking, was not enough. That yes, it's good to pour your heart out to a therapist and discuss problems, but we live in a body, and we have a sense of spirituality, and we all have a diet, and we all have a way of living in the world, and none of those things can really be addressed in a really effective way just through talk therapy or psychotherapy. So I always try to recommend to my patients to not only talk to someone like me, but to see someone like Dr. Shekhar to take care of the whole system, because we have a very complex physiology, and the mind is very complex too. Most people want to have peace of mind, but they don't know how to get to it. This is the way to quickly and effectively get to balance in the mind as well as the body. And that's really the goal, is for a healthcare provider. Now, as far as my books and things, I have worked in the addictions field, which is another area that Dr. Shekhar has expertise in, working with people who have alcohol dependence problems, drug dependence problems. We know now with the fentanyl addiction and other addictions, it has become a very massive problem, and it affects the whole world, not just the United States. And some of the books that I have written have talked about the healing from addictions through psychological and spiritual approaches. And I even did one book on how transcendental meditation and Ayurveda, Maharshi Ayurveda, can be used to heal addictions, because addictions is physical as well as a mental compulsion. But in traditional addictions treatment, the body is often neglected or not even talked about, even though we acknowledge that addiction is a physiological disease as well as a behavioral and mental imbalance. So the books that I did initially were focused on, treating addictions, healing addictions, and also dealing with people who have a psychiatric disorder and an addiction at the same time, something we used to call dual diagnosis. It really means multiple diagnoses. There's rarely only one disorder that somebody has. There's usually related problems, or sometimes several disorders at the same time, which is a lot of area you have to cover. So my books and work focused on helping people who have psychiatric problems, maybe on medications for them, and also are compulsive gamblers, maybe have a sexual addiction, have addiction to spending, credit card addiction, and all these behaviors are compulsive. So Ayurveda and certain specialized psychological knowledge can help break those toxic, compulsive behaviors and get somebody back to normal living and get out of debt and get out of the imbalances in their life and the psychological alienation that can often come with family members and other people that are associated with addictions. So I did a number of books in that area. And then later I realized that there's a lot of talk of spirituality in AA and approaches to addiction, but not a real clear understanding of the spiritual side. AA talks about having had a spiritual awakening. That's the last step. Well, how do you get to have a spiritual awakening? So I wrote a book called Awakening the Spirit, and it was all about how to culture and cultivate a spiritual awakening, and all the physiological and brain research we have on meditation and contemplation and prayer and other practices that can bring about a spiritual awakening, because that's an area that's mysterious to most people. What is a spiritual awakening? What are you talking about? I never had one, and I thought that addicts and alcoholics and chemically dependent people needed to get some more specific information about and suggestions on how to approach getting to a higher state of awareness, a higher level of spiritual functioning in their day-to-day lives. So that was the focus of that book. Also did one on treating the impaired professional. A colleague of mine, Dr. Deborah Bavino, who is a lifelong nurse practitioner and also a very good clinical psychologist, and I did a book several years ago on how to deal with impaired doctors and lawyers and people in high-powered places, quote unquote famous people who have particular stresses that us everyday people don't have to deal with. There's a lot of burden that comes with fame or comes with power and influence. So we tailored addictions treatment to the professional who needs help in a more tailored, specific way, just as Ayurvedic treatments are tailored, as Dr. Shekhar says, individualized. That's what we tried to do with, as much as we could, with people who we call them pedestal professionals. We put them on a pedestal, a doctor, and they're supposed to sort of, be more higher functioning than the regular person, and but they have their own types of stressors, and a lot of them develop an addiction. They try to hide it, and a lot of them run into problems with their licensure and other things, and money and power often bring as many problems as it does benefits. So that was a focus of one of the books that Dr. Bavino and I did, and I also did a book on transcendental meditation as it applies to medical care, psychological care specifically, and how it works with other healing modalities. So the last book I did with Dr. Morello, who's a fine school and clinical psychologist in Chester County, Pennsylvania, which was again a practically oriented book on cultivating spirituality for anybody, not just somebody with an addictions. How to use prayer, how to use contemplative practices, how to use the knowledge that we know about health and an approach to understanding God, understanding other people. And that book was a self-help type book. And so that's kind of an overview of the different areas that I have focused on in university teaching and with writing and in journal articles, sometimes magazine articles. And I found it very interesting and fulfilling to move beyond just my individual practice and try to reach as many people as I could through publications. And to a certain extent, I think I've been successful in that sense, and still have a continuing interest in it. And which is something I'm discussing with Dr. Shekhar. Hey, what will my next book be? What will his next book be? Maybe we'll collaborate together and do one, because we both come from two different countries, two different social backgrounds, two different professions, but it's fascinating when it comes together in a complementary way. And I know I'm fascinated, and I consider myself a lifelong learner. And I've learned more in the 5 days here at his clinic than I think I have in the past 10 years, just taking psychology courses. And so that, in answer to your question, Dr. Shekhar, that's what I've been focusing on with my publications.
Thank you, Dr. David, for such a wonderful explanation about your books, and our viewers are really going to enjoy it. And you can feel these books are also available on the Dr. David O'Connell. You can put it his name. All the books will pop up in the Amazon. You can purchase it. And by listening to his talks and everything now, I felt like that we should have a conversation on the integrative wellness or integrative health. And we met some of the doctors here. We have a wonderful doctor here in Pennsylvania, Dr. Christine Comte, MD, psychiatrist. He loves Ayurveda, yoga, and he is a practitioner of yoga also. And he learned yoga from the Bobby Misiti, yoga teacher, Ashtanga yoga teacher. She travels from Pennsylvania to all the way to Hawaii. He has a center there. And she studied Ayurveda and as well as functional medicine and everything. And we have also Lisa Brand. He's a yoga teacher. And I introduced to Dr. David also. And she has a wonderful knowledge about the Kripalu style of yoga, as well as meditation, relaxation, and so many things. She studied Ayurveda also with us in India. And we have also Dr. Deborah, who is a psychology background as well as nurse practitioner. And we have wonderful people are there together. We can bring them together and a conversation about the integrative health. As an online conference type of thing, like we can do it via Zoom. People can participate and learn from these experts how to integrate yourself, good health and everything. And thank you very much for all of you for joining, and Dr. David for joining with us. And we are very fortunate. Please visit our website, ojas.us, and Ayurveda Wellness Center. And you can see me, my name, Dr. Shekhar Annambhotla, a classically trained Ayurvedic doctor, integrative licensed massage therapist, practicing in Pennsylvania. We offer various levels of Ayurveda therapies, including Ayurvedic cooking classes, vegetarian cooking classes, meditation, relaxation techniques, and whatnot. Whatever you feel, we bring the energy to you, and you feel that energy within you, and you start to heal yourself. And thank you one and all. Namaste to all.
Namaste.